to welcome you to the VACCELERATE webinar. As you can see, the meeting, of course, is as usually recorded. And today we have a great pleasure to invite two of my colleagues from the European University of Cyprus to present a VACCELERATE study. A VACCELERATE study that is based actually on assessing the willingness of future healthcare professionals, mainly as we will see medical and paramedical students, to participate in vaccine clinical trials. So it's a great pleasure from the VACCELERATE Cypriot team to present actually Andreas Yiallouris and Filippou, who are faculty members at the European University of Cyprus. And before starting the presentations, I would like to sincerely thank, of course, apart from the VACCELERATE coordination team, all the national coordinators that have contributed to this pan-European study, and also the students, the medical and paramedical students that supported this VACCELERATE initiative. And with this word, I would like to give the floor to Andreas, actually, to start the presentation. So, Andreas and Charis, the floor is yours.
Thank you, Zoe. Good afternoon, everyone. Thank you very much for joining us today for this webinar. My name is Andreas Yiallouris, and together with my good friend and colleague, Dr. Filippou, we are going to present you our project, which is assessing the willingness of future healthcare providers' participation in vaccine clinical trials. Before we dive into our project, we need to acknowledge and take a moment on the 20th of May as the International Clinical Trials Day. Almost 280 years ago, James Lind performed the first clinical trial, which paved the way for new treatments, new vaccines, and in general to improve the patient's quality of life. And by saying clinical trials, there are a lot of factors that are affecting the decision of someone to participate in clinical trials, under which lens someone sees these clinical trials. And these factors vary from the awareness and education. It's found that the people with more knowledge are found to be more positive towards clinical trials, as well as personal and familiar experiences that also serve as an adding factor regarding the participation of clinical trials. Of course, as clinical trials willingness, there are some concerns of this population, like privacy concerns, personal data management, as well as any risks that these people are undergoing through their participation. All of these we need to take into account, because we all need to fight for a trust, the trust not only for the healthcare system, but also for the pharmaceutical companies. We all need to join forces to improve this trust, to fill any gaps regarding the participation of people in these clinical trials. So as a previous study that's recently been published on the perspectives of patient advocacy groups in their participation in vaccine clinical trials, it's found that people belong in this category. They have a trend, a positive trend to participate in clinical trials. And this project was also paved the way for this one that we are presenting today, which is the assessment of the future healthcare providers and how they see, under which lens they see their participation in clinical trials. Of course, this is a highly important because these future healthcare providers are the ones that are going to shape the public perceptions and vaccinations, as well as trials. And by enhancing this participation and trust, then we have an adequate number of people participating, which is going to be very helpful for future vaccine research, and of course, critically support the future vaccination programs as well. So what we did here, and this time I would like to mention that this project is about to publish in the next few weeks. We conducted a cross-sectional online study using a standardized questionnaire, which was targeted in medical and paramedical students across 11 European countries. The distribution period was 6 months from June to November 2023 via Google Forms, and the questionnaire was available in 11 languages by the help of the translation by the VACCELERATE Consortium national coordinators and distributed via student networks and universities with, of course, weekly reminders to increase the participation, and where was needed, bioethics licenses also being obtained. And then, of course, statistical analysis take place to clear and filter the data, and of course, stratifications in order to have an idea what happens through the years of study or the program of study, because we're talking about medical and paramedical students. Paramedical students and these medical sciences contain a lot of different programs. So we did some stratifications to clarify any similarities or differences found in this type of population. So out of these almost 1,400 participants, majority of them were living in urban areas, which the highest participation obtained from Germany, Cyprus, Czech Republic, and Italy. And the majority of them were in the age group of 17 to 24 years of age, which the highest percentage being medical students and nursing students, but we also had high participation from psychology, pharmacy, dentistry, and other health sciences disciplines. So the primary source of information of this type of students were from healthcare websites, international health organization websites, and healthcare workers. But more into the details and the findings of the study will take place by my colleague, Haralambos Filippou. Haralambe, the stage is yours.
Thank you very much. Hi, everyone. It's a pleasure meeting you. So now in regards to the students' attitude towards vaccination in general, but COVID-19 also, we can see here that the majority are positively towards vaccination in general, and more specifically in COVID. In regards to their attitude, if it has changed towards vaccination after the COVID-19 pandemic, we see that the majority of them has not been affected. We have almost 20% of students saying that it has been affected, but currently we are not sure if it's positively or negatively. And a small percentage, around 10%, stating that they are not yet sure if it has been affected. So we took it one step further to compare between medical, paramedical, and clinical, preclinical in terms of medical students. And we can see that when we compare between medical and paramedical, the vast majority of medical students, they show a positive attitude towards both vaccination in general and COVID-19, where paramedical students, they are less positive than medical students. And when we compare it between clinical and preclinical medical students, we can see that the clinical students, they show more positive attitude. Possibly this has to do because clinical students, they are engaging with clinical staff in hospital rotation, so they show more professionalism and more responsibility due to their experience with the real world they have in hospitals. Now, in terms of medical and paramedical, we can say that the difference is because of the curriculum that they follow at the university where they study. Now, when we checked between EU and non-EU students and students from North EU and South EU, we can see that from the figures here that non-EU students, they are more positively towards vaccination in general and COVID-19 vaccination. When we compare it with North EU and South EU, we see that students from Northern EU countries, they're more positively towards vaccination than when we compare it with South EU students. Now, their willingness to participate in vaccine trials, we can see here that there is a 50-50 between yes and no, but we have a huge percentage that they are not sure yet. And the reasons behind that, and this what I was getting with my students when we had discussion during classes about vaccine trials and clinical trials in general. Their concern was mainly they don't want to be a test subject, or they are concerned about potential side effects. So I will say that I'm not surprised about the results that we observed in this slide here. Now, their willingness to participate in vaccine trials, both COVID and in general, but in non-vaccine trials, when we compare medical students with paramedical, we can see again that medical students, they show more positive attitude towards vaccine trials when we compare it with paramedical students. But in non-vaccine trials, we can observe that their results are equal. Now, the willingness to participate based on countries, again, the North EU, they are slightly ahead, but we could say that is more likely equal, their attitude in terms of both COVID-19 vaccination and vaccination in general. And again, the willingness to participate in non-vaccine trials, again, we have almost equal answers here as well. Now, their motivation for non-COVID-19 vaccine trial participation, we see that our students, they want to become a part of the solution, showing again professionalism and increased responsibility towards their fellow people. Also, and this is where my colleague also mentioned the trust. They need that healthcare and international health organization websites such as WHO, PubMed, and Mayo Clinic were at the top of their choice, and that indicates the high trust in these platforms, which is very good, very promising. But we've seen a variability in willingness. Although there was a general positive attitude towards vaccination, both COVID and in general, their willingness to participate in future vaccine trials showed a variability, with some students also indicated that they are unsure about participating. And that has to do mainly with the key takeaways from this slide here, which we have to, in order to enhance vaccine trial participation, we have to take into account the importance of education. We need to highlight the need for prompt and comprehensive educational approaches, especially in the medical curriculum. We need to strengthen the trust of the public by emphasizing the necessity of multifaceted strategies to address concerns and foster that trust, and of course future policies and campaigns and campaigns by understanding the diverse perspective and motivation, which is crucial for effective public health policies in order to aid in the recovery and resilience in global health. And of course, we need to revise the medical education, to integrate and advocate comprehensive training on vaccination and trial participation to empower the future healthcare professional to address public health challenges effectively. Thank you very much, and we are open for any questions.
Thank you very much, Andreas and Charis, for your excellent presentation summarizing actually the results of this VACCELERATE survey. And I think it was a nice snapshot showing from almost 1,400 students their perspectives. From my side, and then I will give the floor to the attendees to ask or comment on the results. We saw almost 38% of the students being unsure if they would like actually to participate in future vaccine clinical trials. So if you would like to summarize some recommendations in order to improve, as you also mentioned, the education of the future healthcare providers in order to increase vaccine confidence, what would you suggest?
Hi, yeah, I can take that question, Zoe. So yeah, I can think a couple of reasons and a couple of recommendations of that. First of all, as my colleague said, we need to have an integration into medical curricula. We need to incorporate comprehensive training on the importance of vaccinations, of course, and the clinical trial process within medical and paramedical education programs. This should include probably case studies, historical successes, and current practice development. Also, this can take hand by hand with hands-on experience. We can also give opportunities for students to engage in clinical research, which this is going to motivate them and increase their confidence. And also another recommendation, it could be the public health campaigns. We can involve students in public health campaigns and community outreach programs that could enhance their communication skills and ability to advocate for vaccination clinical trials in general.
Yeah, Andreas, I have to admit, I fully agree with you. First of all, from the prompt starting of engaging students in all phases from research to communication, this is very, very important.
And as you know, Zoe, it's better to start from younger years of age, right? So probably from year one, as we now assisting to increase their professionalism and their leadership skills, this needs to be also incorporated into the first year's DNA, which they're gonna, propagate and expand this and be a part of their DNA afterwards as a future healthcare providers.
Exactly, and although, as you said, generally speaking, the results were very positive. What it was astounding for me is to see that also the medical students had significant misconceptions with regards to the reasons for not being willing to participate in vaccine trials, which means something about the medical and paramedical curriculum. And I'm saying that because I think most of us, we are faculty members, so we need to discuss further about these issues from my personal perspective.
Yeah.
Yeah. Do we have any other, let's say, comments or questions with regards to this survey from the audience?
No, I cannot see, Zoe, to be honest. Just
Okay.
on another one. No, we have.
I think
Sorry. Yes, from Meili Gonzalez. Thanks for that. I have one question. Are you planning to do the same study, but with a different target population to evaluate if non-medical professionals share different acceptance knowledge towards vaccine trials?
Yeah. Yeah, that's a good option. It's a good idea. I mean, we started the first one that, as I mentioned in the presentation, it was recently been published on the patient advocacy groups. Now we're about to publish the one with the future healthcare providers. And yeah, of course, there are many types, let's say, of population out there that we need to target. Okay, yeah, we might have another project soon on a different population. To be fully honest, we didn't identify yet. We have a lot of options to run similar projects, but without doubt, we are going again for another similar strategy. I'm not sure if someone else has to add anything on my answer.
I think it would be very interesting, actually, Andreas, because this was an effort and actually a collaborative effort within, especially Work Package 10 and Work Package 4. So maybe we can discuss it further, because I think we might see actually differences, and it would be nice to deep down a bit, maybe also to conduct a bit of focus group analysis and see what is happening actually.
I mean, if we see closer the limitations of the study, it's a cross-sectional study, so it means that it captures a moment, yeah, and the specific population, which is medical and paramedical. So there are many options out there. We may go for different schools rather than medical related programs, or even we can go to citizens out there about in general population or more organized groups of people. It's a good option for sure.
Andrea, actually, as always, I have to admit, Oliver proposed in the chat room something that we have discussed also internally within Work Package 10. I think one of the most important, let's say, initiatives within the VACCELERATE consortium is and will be the VACCELERATE Volunteer Registry, which is practically a citizens platform. And we do have representation from several countries. So maybe one of the next steps, of course, also for non-medical professionals, could be to ask the citizens per se about their willingness and to deepen further and see the differences between the countries, etc. Again, a snapshot, but I think it would be very important because, first of all, we need to keep these volunteers engaged. And secondly, I think it would be a very nice opportunity to use this transnational platform in order to assess what is happening within the community.
100% agree.
Yeah.
I think there is
sorry, yes,
yeah.
We have got another one question from Greet, Henry, from the Belgium team, colleagues. Thanks for the presentation. I have two questions. First, the results in groups of European Union South and North. Did you have enough participants to have this significant outcome? This is the first part of the question. And the second question, sorry, is do you know if there exists some educational project that have proved impact?
Okay, if I may to start answering, and then Andreas and Charis, of course, you can add. With regards to the first question, Greet, first of all, we need to clarify that when we defined EU South and North, we were discussing about the country of residence, and we have also substratified according to the country of training. And we did this, let's say, both certifications in order to see if we had some differences. Of course, as I said at the beginning, we strongly believe that this is only a snapshot. It was a cross-sectional study, so we could not be sure that there are, let's say, really differences with regards to the perception, the willingness between the Southern and the Northern European countries. So bearing that in mind, we just, let's say, reflected the results, but I think we need to invest in our research further to see if there are discrepancies geographical with regards to the willingness and the attitudes. From other, let's say, previous studies, similar ones, we have seen actually some differences. And of course, there are, let's say, some underground, let's say, hypothesis why we can see this kind of geographical differences. But from our study per se, I'm not sure if we could be 100% sure. And with regards to your second, let's say, question, it was not part of this VACCELERATE initiative to track the existing, let's say, educational projects either within the medical and paramedical curricula or outside in order to see if those had any impact on the medical and paramedical, let's say, perception and willingness. But I think this is also a very nice, if you think about it, future, let's say, research, let's say, proposal, bearing in mind that most of us within the VACCELERATE consortium, we do have educational courses related with vaccines and vaccine clinical trials. So maybe we can construct for the next year something like a pre or post interventional study to see the impact in a way on our students, at least. I don't know if I have answered to your questions adequately.
Zoe, I don't know if the Charalambos or Andreas, they want to add something to your remarks and your answer.
No. We just see in the chat that there is another question.
Yes, that's the way I'm asking you if you have.
No, I don't have anything
otherwise...
else. I don't have anything else to add. Only a small sentence in the second question where they, if there are any educational campaigns. There are some educational campaigns out there. To be fully honest, I don't remember the names of them, but we don't have any evidence about the impact yet. But as Dr. Pana said, we are also via the VACCELERATE volunteer registry that we are having something on our plans to design something, an educational sort of awareness to educate people, and then we're going to be in place to evaluate the impact. But currently, we don't have any, on hand.
Okay. Thank you. And let's move with the next question from, again, from Mail Gonzalez. Do you have any hypothesis about why there is a geographical difference in the responses?
Yeah.
Okay. One hypothesis could be that North EU countries could be more proactive in terms of vaccination and clinical trials than South EU countries. And maybe also the trust in government and healthcare sectors could be another hypothesis.
Healthcare system structure could be
structure, yeah.
Another option, yeah.
So actually, even I think before the COVID-19 pandemic, there was a lot of literature indicating that in Southern European countries, the vaccine confidence in general, both for the general public, but also, and this is an issue, for healthcare professionals is significantly lower than for Northern European countries. And this was evident also, as we can see here, for the medical and paramedical students. And I have to agree with Charis. I think this is multifactorial and not only purely associated with the healthcare systems and the capacity. It has to do most probably also with social issues, cultural issues, and as also Andreas and Charis mentioned, the fact that sometimes limited trust, as we know, in generally speaking in the governance, might impact also public health related topics, as we see here with vaccination and vaccine clinical trials. And I think there are currently a few, let's say, projects also, I mean, EU funded projects trying actually to understand better all these factors, including social factors and geographical, let's say, differences that might be also not only a target to investigate further, but as we discussed also during the last slides, this is something, a very important, let's say, public health topic in order to improve further as a united, let's say, Europe. So I'm not sure if anyone from the audience, and I'm referring mostly to our experts on that topic, to greet if they have any other, let's say, opinion with regards to the hypothesis. But I think it's a multifactorial, let's say, issue.
Yeah.
I don't know if I can speak, but so my question, and especially on the hypothesis, we have to be very careful in dividing it to north and south, because in our research we also see that even in one country you have typical some medical schools of university where you have students better scoring on this confidence in vaccines due to some extra courses that are given in a certain university. So it's a little bit tricky to say that it's a north-south. Although, and even in the vaccine confidence project on the EU, we did in healthcare providers, we don't see this north-south. We see some countries like, for instance, Portugal has a very high vaccine confidence. So this is not really reflecting on this north-south. But therefore, my question was, do you have enough students in your research to really make this discrimination in North and South? You have to be very careful to do that. But if this is the outcome of your study, it's possible. I don't say that it's not possible. But and the hypothesis that you say, like the trust in government and in healthcare system, this is something that we see that there's a very influencing factor in the attitude. And then I'm mostly talking about the vaccine confidence, not the willingness to participate in clinical trials, because this is something else. There is a link, but it's not a direct link. So that's something, and like Zoe already said, and I can only confirm it, it's very multifactorial. So it's not that you have one factor that we can change, and that something will change on the fact that people want to participate more in clinical trials. So, but yeah, I can only applaud your research work that you did, because we really need more kind of this research to understand even what students are thinking, because these students are the next healthcare providers, and they will promote your vaccine trials in the future. So therefore it's very important to have all these insights in what they are thinking.
Thank you very much.
Thank you very, very much. Actually, there are very, very important points what you mentioned. And among all of them, I would like to strongly emphasize what you also mentioned, that you show that appropriate, in a way, education or training might positively impact these students or future healthcare providers. And this is something that we need actually to discuss further, also within the VACCELERATE consortium, maybe bearing in mind what we discussed earlier, that to check what is the true impact of some targeted courses on vaccine clinical trials participation, because as you, of course, correctly mentioned, there are similar topics, but it's not identical, the vaccine trial participation and the vaccine confidence topic. So I think this can be further discussed and let's say investigated within our consortium.
There is another. Sorry, yes, there is another one question from Eli Gonzalez. I have one last question. During this study, there are some factors that you will change for your next target populations. For instance, such as add additional questions regarding religion, willingness to undergo isolation, mental and physical health, etc.
Yeah, that's a great point. Actually, we have been discussing, and Grit can comment on that several times, on specific, let's say, variables, especially related with religion. But as we said, bearing in mind that we would like to deepen further and maybe have also some focus group analysis, having more detailed, let's say, data about this target population, including, of course, mental and physical health, could be eventually of importance. I don't know if Andreas and Charis would like.
Yeah. I mean, of course, once we decided what is the next target, then we're going to adjust the questionnaire accordingly. Either it's mental and physical health isolation people, or even underserved population. It depends on the target group. Then we adjust, add, remove, or edit the questions accordingly. But whatever the case, I mean, anyway, you can't use the same questionnaire for the same target population. Of course, some questions will be identical, but it depends on the direction of the project.
Fully agree.
And Andrea, actually, you mentioned something which is a very blooming, in a way, also topic that has been discussed and also partially evaluated within VACCELERATE, the issue of underserved or underrepresented populations within, generally speaking, clinical trials, but specifically also for vaccine clinical trials. And this is a priority also from the European Commission. So this is something that we are trying also within the VACCELERATE to see, and hopefully within the next year, we will have also some additional data. We have already published actually one publication related with underserved and underrepresented population and the reasons for not being accessed or participating based on the expert opinion of few stakeholders that we have tracked. But I think it's a very nice topic that we can investigate further. So thank you very much for mentioning.
I mean, it's in the list. Sorry, just the last comment. It's in the list of the factors that are affecting participation of people if they want to have access, for example, to free medical care or a compensation. It's a sort of a reward for the people that they get involved. It's not the main factor, but it's still in the list of the factors that are affecting the willingness of someone to participate.
Yeah.
And especially for the people that they are underserved or they're not that lucky in life, we do need to have this type of population in mind, of course.
Fully agree. And we will share actually the publications of VACCELERATE are open access within PubMed. Andreas mentioned the previous one, focusing actually on patient advocacy groups. Another one, as I said, is focused on underserved and underrepresented population. And we will keep on going because it's a dynamic process when we refer about willingness and attitudes. And I think now in the interpandemic era, it is very, very important to keep both healthcare professionals, but also the public and the future healthcare professionals engaged. Thank you also, Christos, for providing the link. Do we have any other questions or comments? Let me check also. Okay. So if we don't have any other questions or comments, first of all, we would like to sincerely thank everyone who joined the VACCELERATE webinar today, including actually few of medical students that have participated in this study. So thank you all very much. Sanina, actually, I will give the floor from the coordination office to officially close the webinar, and we will be definitely in touch to continue our research on vaccine clinical trials. So thank you very much once again from my side, and thank you also, Andreas and Haralabos, from the great.
Thank you very much.
Thank you very much. Thank you.
Yeah, on behalf of VACCELERATE, I would also like to thank you for this very interesting talk, for the moderation, Zoe and Christos, for all the questions and this vivid discussion. It was a very interesting webinar today. We will have the next VACCELERATE webinar on 12th of June on the topic of good scientific language. So I hope to see you all there. Yeah, have a good rest of the day and stay healthy. See you in June. Bye.
Thank you very much. See you in June.
Bye-bye. Bye.
Thank you very much. Bye-bye.